Alright, quick question. Have you ever wondered what happens on the dentist side of Invisalign? Not the trays, not the smiles, but the secret dashboard doctors log into every single day. I am Rasim, and today we are cracking open the Invisalign Doctor Login. Dr. Esma, people think it is just a username and password, right?
Rasim, if only it were that simple. Behind that login is the entire brain of the treatment. Planning, tracking, approvals, even tiny tooth movements. One wrong click can change everything.
So, if you are a dentist or just insanely curious, stick with us. Because in a moment, we will show why this login is the real control room of Invisalign.
And I promise, once you see how it works, you will never look at clear liners the same way again.
Dr. Esma, let me paint a picture. It is Monday morning, clinic is busy, patients are waiting, and suddenly the doctor cannot access the Invisalign system. No plans, no approvals, no updates. That is not just annoying, that is stressful.
Exactly, Rasim. I see this all the time. New dentists forget where to log in. Assistants use the wrong account, or someone clicks an old link. And when that happens, treatment planning stops instantly.
And patients think the trays are late, or something went wrong with Invisalign itself, right?
Yes, and most of the time, the issue is simply access. The doctor login is the gatekeeper. Without it, you cannot see cases, approve stages, or even check progress.
Which makes this way more important than people realize. So, Dr. Esma, this is not just about convenience. This login actually decides how fast and how well a patient gets their smile, right?
Absolutely, Rasim. Every aligner stage, every refinement, every approval lives inside that system. If I delay one approval by a few days, the patient feels it weeks later.
So that one login controls timing, accuracy, and even patient trust.
Exactly. Patients may never see the screen, but they feel the results. Smooth progress means confidence. Delays create doubt, even if the trays look perfect.
Which is why understanding this login is way more powerful than it sounds. Dr. Esma, give us some background. How often does this login actually come into play during a real Invisalign case?
Rasim, almost daily. For an average Invisalign case, I log in dozens of times, approving digital setups, checking feedback, tracking tooth movement. One case I had needed 3 quick refinements, all handled through the system.
So this is not a once and done situation.
Not at all. Think of it as mission control. If the doctor checks in regularly, treatment stays on track. If not, small delays stack up fast.
And that explains why understanding the login process is a big deal for dentists and patients. Alright, Dr. Esma, let us put on the science glasses for a second. What is actually happening behind the scenes when a doctor logs in?
Rasim, the system is built on biomechanics and data. Every tooth movement is calculated in fractions of a millimeter. When I log in, I am reviewing simulations based on bone response, pressure limits, and biological timing.
So it is not guesswork, it is controlled science.
Exactly. The login gives doctors access to those calculations. Approving a step too early or too late can affect comfort and efficiency.
Which means that simple login plays a huge role in how smoothly science turns into a smile. Alright, Dr. Esma, let us finally break it down. If a dentist wants to log in the right way, where does it start?
Rasim, step 1 is simple but critical. Use the official Invisalign Doctor portal, not a bookmarked shortcut. Step 2, enter the assigned clinic email, not a personal one. Step 3, verify the security check. That is it.
So most issues come from skipping those basics, huh?
Exactly. Once inside, the dashboard shows cases, alerts, and approvals. If dentists follow these steps every time, access problems almost disappear.
Simple steps, big difference. Before dentists rush to log in, Dr. Esma, what are the big mistakes they should avoid?
Rasim, the biggest mistake is sharing one login across the clinic. Each doctor and assistant needs proper access. Another common error is ignoring system alerts. Those notifications are not noise. They guide treatment timing.
So, do not treat it like a regular website.
Exactly. Do log out on shared computers. Do keep passwords updated, and never approve changes without reviewing the simulation carefully.
A few smart habits can save weeks of treatment time. Feeling a show to see.